Everyday habits slowly degrade our mobility. Hours spent slumped forward at a desk or repeating the same physical tasks gradually apply uneven stress to the body, creating stiffness and discomfort that is all too easy to ignore. To understand why, look at the musculoskeletal system. This anatomical map highlights the interconnected network of muscles, joints, tendons, and ligaments. Because it operates on a kinetic chain, tightness in one area creates unnatural tension that cascades into surrounding tissues. Chronic musculoskeletal pain functions as a diagnostic alarm, signaling a mechanical failure deep within the body's interconnected framework. There is a persistent myth that you can cure creeping aches, reduced flexibility, or recurring joint stiffness simply by resting or taking over-the-counter pain medication. But ignoring these early warnings forces your body to adapt poorly. Healthy muscles take on unnatural loads to compensate for the weakened area, leading to permanent movement imbalances and severe overuse injuries. The clinical threshold for action is clear. When pain persists beyond a few weeks or continues to recur the moment the medication wears off, passive rest has officially failed. You cannot chemically solve a mechanical problem. Unresolved mechanical failures require an active, structured physical intervention to repair the compromised tissue. This is exactly what the General Musculoskeletal Physiotherapy team at Westminster Multi-Specialty Clinic in Dubai Healthcare City is equipped to solve. Their clinical pathway begins with a comprehensive one-on-one physical assessment. A physiotherapist licensed by the DHA maps your exact movement limitations. The DHA, or Dubai Health Authority, is the government entity that strictly regulates the health sector and medical professionals in Dubai. Many patients hesitate to seek help, assuming they need an expensive MRI or complex imaging scan before they can even start treatment. In reality, that is rarely a mandatory prerequisite. A hands-on clinical assessment is highly effective at testing joint mobility and isolating the exact root cause of a muscle imbalance, entirely without relying on internal imaging. An accurate diagnosis relies heavily on an expert's dynamic evaluation of how your body actually moves and bears weight in real space, rather than just looking at static internal pictures. Once the mechanical flaw is identified, Westminster deploys a multi-pronged intervention strategy engineered to rebuild the body's mechanics from the ground up. The first tool is manual therapy. The physiotherapist uses hands-on, targeted techniques to physically unblock restricted joint mobility and release tightly bound soft tissues. Next is personalized exercise. By prescribing specific, targeted physical movements, the clinician restores structural strength and coordination to the weakened area, allowing it to stabilize the newly freed joint. The third component is postural correction. This is the analytical process of identifying and modifying the specific daily habits and physical alignments that caused the injury in the first place. Throughout these steps, the clinic continuously monitors your pain progression and mobility data. This allows them to safely adjust your individual recovery plan in real time. True, lasting rehabilitation requires this synchronized approach, combining passive joint release with active muscle rebuilding and conscious habit correction. Musculoskeletal recovery is a collaborative effort, functioning as an active, ongoing partnership between the physiotherapist and the individual. While you will frequently experience noticeable functional improvements and pain reduction within your first few clinic sessions, this is only the initial repair phase. Long-term recovery and the prevention of future injuries depend entirely on you consistently integrating the prescribed home exercises into your daily routine. The clinic provides the precise blueprint and performs the initial mechanical repairs. You provide the daily maintenance to ensure your body's long-term resilience. Whether your musculoskeletal pain results from a sudden injury or a chronic, long-standing condition, evidence-based physiotherapy has the tools to reverse the damage. The ultimate clinical outcome is that you move better, feel stronger, and confidently return to your normal daily activities without the anchor of physical limitation. Living with permanent physical limitation is a choice. Actively choose recovery by booking a consultation at Westminster Ortho Med Clinic, located in Block A, Suite 203 of the Ibn Sina building in Dubai Healthcare City. Call +971 4276 5606.